Health Cabinet Secretary Susan Nakhumicha has appealed to doctors to abandon their plans for a strike and give dialogue a chance to resolve challenges facing the health sector. Nakhumicha, who acknowledged delays in the hiring of over 1,200 medical interns, said the ministry was working on modalities to ensure the issue is addressed and pleaded for patience as some of the issues can only be addressed through stakeholder engagement with other government agencies. Doctors issued a 7-day strike notice on Monday to protest delays in hiring of medical interns as well as poor working conditions.
After a day-long protest by health workers in Nairobi that culminated in a 7-day nationwide strike notice by doctors on Monday, Health Cabinet Secretary Susan Nakhumicha has stepped in to avert a possible health crisis. Nakhumicha, who presided over the flagging off of cold chain equipment for vaccine storage to the counties donated by UNICEF and Gavi, has urged doctors to withdraw the strike notice and come to the negotiation table.
Allow a discussion and conversation to take place. As I have said, there are many things that we need to discuss. A strike will not resolve. A solution will only be found when we sit on the table and discuss as all stakeholders.
The Cabinet Secretary says some of the issues raised by the Kenya Medical Practitioners, Pharmacists and Dentists Union will require input from counties, Treasury, Ministry of Labour, Salaries and Remuneration Commission, the Public Service Commission before they are implemented, and urged doctors to be patient.
Mine is to ask for their patience as we finalize that from the meeting they have had with the PS, I'm going to be briefed, we will find a way forward. And one of the important pillars of universal health coverage is health workers. So there's no way I can ignore them. There's no way the ministry can ignore them.
While acknowledging the delay in posting over 1,200 medical interns, which is one of the main issues in the strike notice, the CS says the issue is being worked on as the problem has been persistent over the years due to lack of investment in the health sector.
These facilities must have health commodities that these interns will use. So there are many things that need to be prepared and be available for us to have interns to be posted and for them to acquire the knowledge that they so need under that internship program. So the ministry is putting together all this.
Nakhumicha is hopeful of an agreement with KMPDU officials before the lapse of the 7-day strike notice that was issued. Other healthcare unions, including clinical officers and nurses, had also issued a 14-day strike notice for the government to address their issues or else join the doctors in their strike. Some of the other issues they want addressed is the harmonization of all contracts under the Ministry of Health and county governments, promotions and absorption of the universal health coverage staff hired on contract basis.